by giving it 2 more seed points and updating my segmentation to get also the segmentation of the RCA. In the next step, I'm going to calculate the lumen center lines for the quantifying of the vessels. And first to see the LCX. And one task is to perform the export for the clinical colleagues. You can export anything you want and do a rotation of 360 degrees, and you can change the number of frames and export it to my local database, and it will be pushed to PACS in the background. And also for the LAD, same, just name it that they can find it 360 degrees, 50 slides. Okay, going back to the LCX for the quantifying the stenosis, I have to measure it. Okay, these are my orthogonal cuts, and here is the referring autograde imaging for that. And the degree of stenosis is 64%, so it's a major stenosis for that LCX. And there was also a task to quantify or to show the calcified plaques, and I can just do a ROI measurement in here and also export that to PACS to give the clinical colleagues an idea about it. So that was the CT case. We go to the MRI. I'm going to load the stress MRI into the 4D viewer so that I can assess the time. And now I have to place some, for the semi-quantitative analysis, I have to place some probes here and give them a name and also a nice color. Green here. Let me do one here at that area. That's the part for the LCX. And this point. So then I will push that to our 4D analysis, and you get the time diagram for the values, and we can do a coil correction, a baseline correction, that we pull all 3 baselines over each other, and then you see that the one part is has a higher slope and is getting a higher value. I can also export this to PACS and send it to the colleagues. I'm copying my ROIs, and we'll bring them also into the REST 4D dataset. Okay. And again, with coil correction, pull the baselines over each other, and then you see in the rest the curves are almost similar and has the same slope and get to the same level